Welcome everyone to the next session in our webinar series. Today we're going to be talking about the ABCs of Medicare. I'm joined by Chris Mallon and Andrew Randisi. So Chris, I'll hand it over to you to get us started.
Alrighty. ABCs of Medicare. Get started with some of the basics here. Health insurance for people 65 or older. You become eligible for Medicare 3 months before you turn 65. You're also eligible for Medicare if you are disabled and receiving Social Security disability benefits. So you don't need to seek outside, private health insurance if you do become disabled. End-stage renal disease as well as ALS are all different qualifying factors where you can qualify for Medicare prior to the age of 65.
Okay, Chris and Leslie, how do we sign up for Medicare? The easiest way to do it is online, right at Social Security's website. We do recommend for our clients, and I even have one myself, to sign up for a mysocialsecurity.gov account. From there, you can sign up and see what your Social Security benefit would be at your various ages for retirement, as well as if you should need to sign up for Social Security disability benefits. And also you can sign up for Medicare as well, right on your mysocialsecurity.gov account. You can also call Social Security and speak to your local office and set up an appointment. You can also go to your local office as well. But I know during COVID times, the phone lines and trying to get an in-person appointment can be very limited. So usually the easiest way to do it is by going online. If you're a railroad worker, you can contact the number listed above. And after signing up, no matter which method you choose, in about 2 weeks, they're going to welcome you a Medicare welcome package with your Medicare card. And once you get that Medicare card, it can be time for them to decide your Medigap, your Part D, or your Medicare Advantage Part C plan that can be purchased from a private insurance company, or you can go through your insurance broker of choice. Another thing when it comes time to also wanting to compare which different types of Medicare supplements or Medicare Advantage plans you might be interested in, you can research that right on Medicare.gov's website using the link at the bottom.
All right, the parts of Medicare. So why do we call this presentation the ABCs of Medicare? First off, there are a few parts, and first one is Part A, is your hospital insurance. This helps cover inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. Part B is your medical insurance. I think of Part A, go to the hospital, that's your Part A. Part B is really like your outpatient care, your doctors, your regular family doctor you go to, orthopedics, things like that. This would cover your home health care, durable medical equipment, walkers, wheelchairs, etc., as well as preventative services, your yearly screenings, vaccines, things like that. And then finally, Part D is your drug coverage. So this covers the cost of prescription drugs, including many recommended shots or vaccines. You join a Medicare drug plan in addition to original Medicare, or you get it by joining a Medicare Advantage plan. There are various Part D plans out there, so it's good to kind of shop around and make sure you get the plan that has the drugs underneath it that you need to take. And then plans that offer Medicare drug coverage are run by private insurance companies that follow rules set by Medicare. Again, it's kind of separate from Part A and Part B, something you do have to shop around for.
Okay, what does it cost? Part A is the best. It's free. Uncle Sam picks up the tab on that one. Part B, the monthly premium for 2022 is right now $171.10 per month. Now, as we had on our slides, we put a little asterisk there because that is subject to change based on your income, with a little acronym called IRMA that we will get to a little bit later in a few subsequent slides. Medicare Part B, in addition to the monthly plan premium, has a deductible of $233, meaning your first $233 worth of doctor's visits would be out of pocket before Medicare Part B would be starting to pay. You should sign up when eligible, or you may face a 10% penalty for each year you don't sign up for Part B. Now, this does not mean that if you're still working and working past 65, you have to sign up for Medicare Part B. There are some qualifying events that we'll chat about a bit later, such as if you still work, you don't need to sign up for Medicare just yet. Part D, the drug insurance. These premiums also vary based on the plan you select with a private insurance company. You should sign up when eligible, or you may face a 1% penalty for each month you go without Part D. Like Part B, these premiums can change based on your income. Medigap premiums, which would be the supplement to your Medicare Part B insurance, because Medicare Part B covers 80%, the Medigap covers the other 20%. Those also vary based on age, area, and other underlying medical conditions you might have. Medicare Advantage Part C, which Chris mentioned on the last slide, depends on several factors. It's kind of an all-in-one bundling the medical plus drug. This can sometimes be free depending upon the plan you select from a private insurance company.
Can I ask a quick question? Sorry,
Yeah.
on that slide. Andrew, you were talking about the penalty if you don't sign up, and you said that doesn't apply if you're still working, and we talk about that later.
Yes.
Is that also true for the Part D? I see there's
also true for the Part D if you have qualifying healthcare coverage through your employer, such you do not need to sign up for Medicare immediately at 65.
Great. And then we're going to talk about IRMA next, but I had earlier asked you that what it stands for. It's
IRMA is not my aunt. IRMA stands for Income Related Monthly Adjustment Amount.
Great.
It's a tongue twister.
All right. Carry on. Thanks.
So what is IRMA? Well, I would really consider it's more or less a surcharge for those individuals and couples that make well beyond a particular amount of money per year for income taxes. Medicare charges them an additional, we'll call it surcharge on top of that base $171 premium. How the IRMA is calculated depends on where your modified adjusted gross income falls from 2 tax years prior. So as we look at this chart from 2022, IRMA is going to be calculated looking at your income for your income tax return in 2020. So for individuals who make $91,000 or less, you just pay the base premium. For married couples, 182 or less, base premium. Married filing separate would be $91,000 or less. You just pay the base premium. Where the surcharge really kicks in is for really those, we'll call it higher, more income individuals, especially if you're still working or if you're a small business owner past age 65 and you're making a few $100,000 a year. Your Medicare Part B, and then likewise in your Medicare Part D, the drug insurance, it can get a little bit more costly, but it still winds up being significantly less than if you were purchasing health insurance on your own from either the health insurance exchange or purchasing it through a private insurance company directly.
And here's the same chart, but for Part D, you can see how the various premiums increase based off of your income levels.
Yeah, and a good rule of thumb with calculating your modified adjusted gross income, kind of a back of the envelope test you can do is you take your adjusted gross income on the front page of your tax return and then add back, usually it would be income adjustments. A lot of the times it could be income from municipal bonds or part of your Social Security that was not exempt for taxes. Adding that back is a good way to kind of back into what your modified adjusted gross income could be.
All right, so we talked about Medigap before. I'm going to go ahead and just click through all these here so we can look at kind of the various options. This is basically to decide between going with Medigap or Medicare Advantage. So again, Medigap is your original Medicare, includes, Part A and B, and then you can join a separate drug plan, Medicare Part D. So to help pay your out-of-pocket costs in original Medicare, like your 20% coinsurance you have to owe, you can also buy supplemental coverage, like Medicare supplemental insurance, aka Medigap, or you could have coverage from a former employer or union, or Medicaid. This is better intended if you have severe health problems or if you want maximum coverage. The next slide we'll go to has kind of a chart breaking down the various Medigap plans. So why it's called Medigap is you have all your different parts, and Medigap fills in those gaps, whether it be lower deductibles, different amounts of coinsurance, things like that. And then you have Medicare Advantage. Medicare Advantage is a Medicare approved plan from a private company that offers an alternative to original Medicare for your health and drug coverage. So this is considered a bundled plan. So instead of having Part A, Part B, and Part D separated out, it would be your one Medicare Advantage plan that would encompass all of these. In most cases, you'll need to use doctors who are in the plan's network. So I'd say Medicare Advantage is very similar to kind of the private insurance you've been used to while you've been working. It's like that, except it's approved by, Medicare, larger.
I'd say,
there.
Chris, it best resembles an HMO.
Right.
While Medigap would be more like a PPO plan.
Exactly. And you get some extra benefits in the Medicare Advantage plan, like vision, hearing, and dental services, which are not available with original Medicare. Those are other services that you could, buy with Medigap, supplemental policies. Medicare Advantage usually has that all, encompassed in there. Your out-of-pocket costs can be higher than going with a Medigap policy, but lower than just having original Medicare. So this is more intended for healthy seniors. If you have a lower healthcare costs in your retirement years, Medicare Advantage can be, advantageous to you relative to somebody who's going to have a lot of larger health bills.
So everybody gets, so like the standard is Medigap, and then if you want to if you just sign up for Medicare, you're going to do Medigap. Is that right?
If you sign up for A and B, and then you have that choice.
Right.
If you want the bundle and get if you want the kind of like having the Medigap and the drug all glued together, lower out-of-pocket costs, you don't really travel that much. It's okay that you might need a referral from the doctor. The Medicare Advantage, if you're relatively healthy, Medicare Advantage plan kind of might do the trick for you. If you want to have more of that, we call it on the slide Cadillac coverage. You know what you're going to pay. You're not going to get any real surprise bills, and you do not want to go to you want to go to any doctor in the U.S. You want to see a specialist without a referral. The Medigap is more encompassing, especially if you have more health issues later in life, or think you might have more health issues later in life based on family history.
Yeah, so I guess you could not do Medigap either. You could just have Part A, B, and then D, and then kind of forego adding on supplemental insurance, right?
Yeah, you can do that, but then you're on the hook for that extra 20%.
Right.
Oh,
Exactly.
gotcha. Okay.
Which can be tens of thousands of dollars if you have a medical event,
Okay.
or even more. The flavors of Medigap, I kind of almost reckon this to like Baskin Robbins, the 51 different varieties. So with the 10, there is 10 supplement plan choices. It's almost like alphabet soup, from A going all the way to N. And it covers various type of things, such as Part A, hospital costs, your Part B, coinsurance, first 3 pints of blood, hospice care, skilled nursing, your Part A deductible, Part B deductible, and any Medicare excess charges. From looking at this plan, the best plan would be Plan F. But however, Plan F is no longer available to new retirees or new 65-year-olds because Congress, through active legislation a couple of years ago, closed off Medigap Plan F, that pool, to new signups. What Congress wanted to do, their intention was they wanted retirees to kind of share in the costs and have to at least pay that $233 deductible, which it is right now for 2022. So the plan that covers pretty much everything all encompassing right now is Medigap Plan G is the next best thing. 65 retirees that were turned 65 prior to January 1, 2020 are still eligible for Plan F, which is the more encompassing plan. However, the premiums on that plan may increase a little bit more because the pool of applicants will get lower and lower each year since no new applicants are allowed in.
Makes sense. All right. A common question we get is, what if you're working past 65? So it really depends how you get your health insurance now and the number of employees that are in the company where you or your spouse work. Generally, if you have job-based health insurance through your or your spouse's employer, you don't have to sign up for Medicare while you or your spouse are still working. You can wait to sign up until you stop working or lose your health insurance, whichever comes first. So if you're self-employed or have health insurance that's not available to everyone at the company, you can ask your insurance provider if your coverage is employer group. If your coverage is employer group health plan coverage as defined by the IRS. If it's not, then you must sign up for Medicare, Part B when you turn 65 to avoid paying the monthly Part B late enrollment penalty. If your employer has less than 20 employees, you might need to sign up for Medicare when you turn 65 so you don't have gaps in your job-based health insurance. So check with your employer on those. And then if you have COBRA coverage, sign up for Medicare when you turn 65 to avoid gaps in coverage and a monthly Part B late enrollment penalty. If you have COBRA before signing up for Medicare, your COBRA will probably end once you sign up. So I guess to kind of summarize all that is if you're with a large employer and you have coverage through work, really just kind of, ask your employer, go to HR and make sure to see if you have to sign up for Medicare or not. If it is considered an employer group health plan, is really the safe bet. And then if not, you want to make sure you sign up to avoid those penalties. Anything else to add here, Andrew? This is a common one. People are working past 65 more frequently now than ever. So yeah, any other best practices here, Andrew?
No, it's best to, if you work for an employer, check with your human resources department when you're getting close to turning age 65 to make sure they don't kick you off at age 65, because we've seen with some clients that have worked past 65, they have a policy that's when you turn 65, you kind of get kicked off and then you have to go on Medicare, because with the employer having an employee working past 65, the costs for that participant are much significantly higher than, say, someone 35 or 40 years old. So it's always best to make sure you're on top of it with HR.
I think that's all we got. Again, happy to walk any of you guys through kind of the Medicare sign-up process. I know we've done it. Andrew specifically has done it many times with clients of ours, so we've seen most of the different cases out there and how to deal with the different issues. Jen, feel free to give us a call.
I have two additional questions if you don't mind, guys.
Fire away.
How does an HSA, if you've had an HSA throughout your career, how does that play into Medicare?
Great. So after age 65, one of the beauties of the HSA is you can still take the money out to use it for out-of-pocket medical expenses. You can also, at that point, it becomes an IRA. So if you after 65, you're on Medicare, you can no longer make contributions to an HSA. That's kind of out the window at that point. But if you want to use those monies for a trip, buying a new car with it, you can take it out and there's no longer a penalty for a non-medical expense. It's just ordinary income like it would be an IRA. It really becomes a third retirement bucket, especially if you don't use the monies over your working career, and you're fortunate enough to be pretty healthy that you can invest the cash, or you can invest the cash and pay for any medical bills with out-of-pocket money. from your emergency fund or any type of savings or checking account.
Yeah. And you could, of course, use it to pay your Medicare premiums as well.
Yeah, you could use it for the premiums.
Yeah. And then my last question is about a spouse. So this really, it's very individual. So if your spouse turns 65 and you're 62, you can't get Medicare. Only the person that's 65 can get it, right?
Only when you turn 65, or as Chris mentioned on that first slide, you're a disabled person, as determined by Social Security disability definition, or if you have end-stage renal failure, ALS, and I believe that those other couple of qualifying conditions.
Yeah. So we've had cases like this where, a working spouse retires, he or she can collect Medicare, but their younger spouse is not eligible yet, but yet there's no work plan any longer, right?
Yeah,
Right.
It often throws a curveball for the spouse that's a few years younger. So you can either you do COBRA until COBRA would run out for that spouse and other qualifying dependent, as well as then we'd be either turning over to purchasing private health insurance directly from like a Blue Cross and Blue Shield, or going through the healthcare.gov exchange from your state.
Yeah, well said. Often an expense overlooked by a lot of people when they near retirement. There's a younger spouse who's, like you said, on the retiring spouse's retirement plan, or just early retirement too. A lot of people, some people do want to retire before 65, and it's definitely something you have to account for.
Right. Okay. That's the end of my questions.
Great.
Thanks, guys. Thanks for the info. And please give Andrew or Chris a call if you have any questions about the ABCs of Medicare. We're happy to help.
All right.
Take care, everybody.
Later. Thanks.
Bye-bye.